Mga kasugbo, maayong buntag. Aniya nasab kita sa atong programang Kumusta Kasugbo? O karong buntaga mga kasugbo, espesyal niya nga ato ang pagahisgutan tungod kay kauban nato ang ato ang mga guest gikan sa Vicente Soto Memorial Medical Center. Kauban nato si Dr. Jamaica de la Cruz, ang atong KAAMBAG Physician.
Morning.
Good morning, Doc. Mariella Campos, atong KAAMBAG Nurse. And si Sir Lucky Salma President sa AIDvocates. Sakto ba, Sir? AIDvocates?
AIDvocates. Morning.
Okay. So, good morning. Welcome to Sugboanon Channel.
Good morning.
So, kumusta? Kumusta, Sir, Ma'am? Sa ato ang pag-ari? Wala na ba
Very good.
Kira and excited.
Excited. Sige. So, how are you feeling man sa about aning inyong guesting karon na?
Sa pagkakaroon kay sa ginaingon ko nga excited gyud ta no sa pag-promote karon sa amo ang event this coming December 1 ang BASKOG RUN.
So before that Ma'am Mariella, unsa man dining KAAMBAG Clinic?
Ang KAAMBAG Clinic is one of the oldest treatment hub, HIV treatment hub diri sa Cebu. So, naani siya sa Vicente Soto Memorial Medical Center. So, we cater 1,200 patients alive on ART. So, mga PL-HIV patients ni siya.
Unsa man ning PH-HIV patients?
People living with HIV. So, when we say about people living with HIV, so they live with HIV within their lives na gyud. So as we all know that HIV is no cure yet, so naatay treatment for lifetime.
So when man ni nag-start ang ato ang KAAMBAG Clinic, Ma'am?
Ang history ani is way back 2011. Our first patient there in KAAMBAG just for 4 or 5 until we made it to 1,200 na.
So good thing, Ma'am, no, kay ang atong mga tao naghinahinay sila ka open bitaw to check themselves.
Yes, that's why this BASKOG RUN is aimed for not just for the benefit of this with the prevention and mother to child, but also this is used to aware with the people around Cebu na to lessen the discrimination and stigma about HIV.
So kani ma'am, unsa man day ang mga services sa KAAMBAG Clinic para sa mga tao unsa man day ang ilahang makuha nga benefits?
Okay, since KAAMBAG Clinic is a treatment hub for HIV patients, so first is we have HIV testing and counseling. So diha na to mahibaw-an if ang patient is reactive or non-reactive. So if reactive, then he or she will proceed to the treatment. So ang treatment is lifetime, and then there is consultation, monitoring of CD4 and viral load. So kaning CD4 is the number of immune system, and the viral load is the number of HIV virus in the bloodstream sa patient.
So if mag-undergo na og treatment, ma'am, unsa may process na every month sila mo to?
If first fathers monthly monitoring pa until nga ma-stable na siya, makakuha na lang siya og every 3 months nga medication. So 3 months monitoring na.
Sorry kung Doc Jamaica.
Yes, sir.
Doc, pila ka years diha sa KAAMBAG Clinic?
Actually, recent lang jud ko nga na-hire sa KAAMBAG Clinic, but I have been training as an internist for 3 years, recently graduated, and currently working sa KAAMBAG Clinic as an HIV physician. So, actually, tulo mi kabuok, no? And along with our case managers and social workers and also nurses and katong among medtech, we formed the KAAMBAG treatment hub. So it's actually one of the biggest treatment hubs in the Philippines, which is also accredited to VSMMC, kay it's a referral center man. So all kinds of, we cater to all kinds of referrals. So if, for example, you have HIV patients na medyo bati-bati og status, we can just easily refer to the ER or to other subspecialties, which is also an advantage na gina-avail sa mo ang patients. So, like what Ma'am Mariella said, we offer testing, we also offer treatment, at the same time counseling, and then monitoring also sa mo ang patients. So, it's not just the medical aspect, no. Currently, we're also trying to broaden amo ang horizon, like to make it more holistic. So right now, we're still figuring things out, pero as we go along, hopefully ma-finalize or really put into practice ng kanang psychological evaluation and also consultation will also be part of the services na ma-offer sa KAAMBAG. So it's not just for people with HIV, it's also for people who want to prevent HIV. So we also offer preventive medications. Then at the same time, we also offer counseling and also testing and treatment for pediatric patients, so mga bata, no? And also mothers nga currently battling with HIV, because obviously you don't want na mother-to-child transmission, which is also one of the aims sa BASKOG RUN, no? It's one of the advocacies nga gina-try na mo channel through the BASKOG RUN. So actually the scope is very broad, so it's hard to explain it in just a few
Pero naka-try na mo,
sentences.
Dok, kanang maglisod jud og cope up bitaw nga mga patients, like
Yes.
maglisod og dawat sa ilang kaugalingon.
Yes, of course. I don't think it's easy also to be diagnosed with that, because like what was mentioned, it's a lifetime diagnosis. So, but even though walay cure, it can be controlled. We have a lot of patients who live very normal lives, like they can work, like they even can raise a family. Yeah, as long as they keep on taking their medications, as long as they go to us for consult regularly, then they can live very normal lives, you know, as long as kanang makita na mo sila and matest na mo sila from time to time, then it's like wala na sila sakit, like outwardly, you know, as long as they maintain, of course, yung medications. And then we also have patients on the other end of the spectrum na medyo bati-bati jud og status, and sila na usually not all the time, but sila na usually ang dili makatake sa ilang meds because di sila ka-accept sa reality sa ilang situation, which is why we're incorporating psychological evaluation na little by little. It's still being it's still on the trial and error na process. We're still kanang configuring everything out pa.
So unsa may inyong mga challenges diha, Ma'am Doc?
A lot actually, because of course since 1,000 kapin ang patients,
yeah.
you can't expect them to follow up, all of them to follow up, because I think there's a lot of factors that you would consider, since Soto man siya. So we have patients from all over Cebu, and we also have patients from other provinces who prefer to have their kanang treatment plan with us. So ang gilayo nila, we consider na we have patients from Malabuyok, Ginatilan, mga lagyo na gid kaayo, and ang challenge is to have them follow up regularly nga kanang kasi of course even though libre ang amo ang services, ang plite mismo sa pagpadong sa city is very
Costly.
mahal. Oo, like kanang mga, like example, like mga taga-bantayan mo, larga pag yun, mag-barko pag yun sila diri, and that alone can cost like what, 1,500 to 2,000 ang per trip. So challenge yun siya sa amo ang end, kung saan na mo pag maintain ang adherence sa patients nga dili sila mabankrupt pod mga ginana. So slowly but surely offer me og delivery sa tambal kanang LBC para less na lang ilahang gasto, or if kanang di good madang sila mo'y maka-pick up sa meds because they have kanang work pa, duty pa, then we also offer nga i-maxim na lang or ihatod na lang yun kung asa sila ba. Kay it's also one way of bridging the barrier between the clinic and the patients.
Pero do you have kanang kuan out of town nga mga check-ups or like mga testings.
Outreach.
Yeah,
May mga
outreach.
inana.
Naaman may outreach, but of course, I think
It's like,
by invitation siya cause I don't think because HIV is a very magkakaroon heavy pagid kayo ang stigma sa HIV.
Yes.
So if you go there kay murag basin ba dili ra gyapon sila mo participate kay
Mahal
they
yun.
have a very negative view of the disease itself, but if sila mo nag-invite, meaning they're willing to listen, they're willing to have themselves be tested, but of course hopefully that would change in the next few months.
So kanibang inyong invitations, Doc, if i-invite mo like for example NGO or like mga barangay baron SK, unsa man ni willing ra mo moadto sa jud ana?
Yes, of course we go to schools, mga provinces, ana of course invitation sa mayor, mga invitation sa mga LGU. We can go there man sir.
Another on the other hand, alita sa AIDvocates, kay curious ko unsa man dining AIDvocates, unsa organizations ni siya or
ang AIDvocates kay sa non-government organization ni siya na founded ni siya 2018. So 7 years na mi. And then grupo ni siya og mga tao na naay usa ka common na goal for HIV awareness. So nag-start ni siya sa Mandaue Pride. So nagtapok na sila niya. So na oy kining ganahan ko mag-create o organization niya. Ilahang common dyan na ilahang identity is HIV. So gibuo ang AIDvocates. Then mo na to until now napagyapon mi, and then we are compose mi og mga lain-lain na mga tao. Like we have from BPOs, we have students, we have professional doctors, nurses, medtech, may nana.
so how do you get people to join you, sir? Sa mga members ninyo?
As among member, sa una, kay post mi sa Facebook na may training for counseling or for peer education and then counseling, and then we also need volunteers. Yung na-stop siya katong pag-pandemic, and then up until now, we are still trying to reach out sa this is sa KAAMBAG or sa City Health to help us do the peer education. Karon kay lisod-lisod siya, kay need mo siya og kanang kwarta for the peer education. Pero slowly but surely, hopefully next year, kasi daghan na kaming plans na ibuhat, so hopefully next year we can invite more volunteers.
So kanang how do you team up with with the KAAMBAG Clinic or you reach out mo ana?
Yeah, we recently nag-team up ani Doc Helen, Madam ba actually reach out to us na kaning mag-create or maghimog event for the World AIDS Day, which 2018 nahimo na namo sa Ayala, amo ang first ever World AIDS Day run. So mo to Doc Helen reach out to us and then said, "Lak, ganahan baka na mag-organize for the run." So ay ko sure Doc, kay dugay-dugay na po wala ka activity, and then moto. So we organize everything, and then karon we are tied up with KAAMBAG. Hopefully mahimo ang memorandum of agreement for the two of us, because we are also doing outreach program. So hopefully if makuha ang memorandum of agreement, then we will team up with KAAMBAG, and then amo ang reach kay katong reach out na yung mention ganina, kasi we always go good outside po sa Cebu. Like namin mga invitation sa Argao, sa Fernando, then so dito po may mag-testing, and also dito po sa SK sa Cebu City.
Nindot kayo bitaw na sir no nga kanang ma-open mahinay-hinay bitaw ka open up do sa una dugay naman jud na to gihinay-hinayan sa ato ang mga youth nga pag-educate nila ana, pero mas nindot nga walay hunong bitaw gihapon ang ato ang pagpaambit nito sa mga tao kung unsa jud ay ning HIV ug nganong importante nga mailhan nila ni siya ug nganong dili ni angay kahadlukan or like kahadlukan sa pero dili angay nga ikauwaw bitaw if in case
Tinuod, sakto jud na. And karon appreciate na ko ang SK kay murag we have 5 or 6 kabuk SK invitation for the year na invite